Welcome back to Cancer Buzz. I'm your host, Summer Johnson. We're here in Washington, D.C. at the ACCC 51st Annual Meeting and Cancer Center Business Summit. I'm here with Dr. Barrett, who has been president of ACCC for the past year. Your term is winding down, but it has been punctuated by so many incredible highlights. I'd love to talk to you about that today. Dr. Barrett, how has the week been going for you?
Oh, first of all, thank you for having me, Summer. It's always a pleasure to really talk about the great work that we're doing at ACCC. And so far, it's been an amazing week. The sessions have been phenomenal. The attendance has been great. Even advocating for policy at the Capitol yesterday. So it's been amazing.
So let's start with the presidential theme that guided the last year of your life and ACCC's programming. Tell us about that.
Yeah, absolutely. You know, I've been really excited about the theme. The theme was advancing community engagement and cancer equity, really focusing on cancer equity in terms of health outcomes and community engagement, and also research and access to clinical research and trials. And so it's really an exciting opportunity. You know, during my time as ACCC president, we've engaged and broadened our cancer care community in many unique and compelling ways that will have an impact in the communities where we live. And our membership, our work recognizes the opportunity to advance health equity, which is really defined as the state in which everyone has a fair and just opportunity to attain their highest level of health. So for me, and for this vision and this goal over this past year, is really thinking about communities broadly. And we'll see a number of different ways in which this has happened over this past year that I'm really excited to talk about and share with you and the listeners.
So let's talk about all of the things that happened at ACCC. Well, we might not have time to talk about all the things at ACCC, but we're going to talk about the highlights. ACCC turned 50 this year.
Yes,
Tell us about that.
Yeah, ACCC turned 50 this year. An incredible year. We really had some pretty significant goals too over this year, which has been incredible. But the goal and our name is now Association of Cancer Care Centers. We removed the word community, not because we were trying to be exclusive, but actually to be more inclusive, to recognize that cancer care is provided in academic health centers as well as community oncology clinics. And we wanted to really capture the breadth of that and all the work that's happening. So that was important. And so that's why we changed the name. And that was a big one to do, especially as part of our 50th. We also did some other exciting things. Do you want to hear about it?
I do. I want to hear all of it.
Awesome. Well, one of the other great things we did is that we really wanted to increase our membership over this time. And so going into this year's presidency, we were at about 43,000 members, which is actually great and awesome, especially when you think about our footprint across the country. But we said, let's do a little bit more. And so over this year, we've actually increased our membership to another 3,000. So now we're at 46,000, a little over 46,000 membership, which is a great opportunity for more people to have access to our incredible resources here at ACCC, including people from all parts of the cancer care continuum and cancer care coordination. And so we're really thrilled to be able to be a part of that work.
There's a new strategic vision and plan and a new executive staff. Let's talk about that.
Oh my gosh. Yeah, we are really fortunate to have our new executive directors. You know, Christian Downs has retired. Absolutely amazing man that has truly left a legacy here for us for ACCC. We also then now have the privilege of welcoming our new executive director, Megan O'Neill. She is outstanding, incredible expertise in cancer, particularly around policy, as well as strategic planning and direction. So we're really just thrilled to have someone who's really ready to take the organization to the next level. And so that was another big win for us this year.
What about the palliative care event that I know that you just did in the past couple of months? That was a really big resource for members.
Yeah. And so this is another part of my theme, right? It's really thinking about when we talk about communities, I first and foremost think about the communities we serve. They are experts, they are partners, they are collaborators. And so I work very closely with our community partners in that space. But in this space, I really wanted to also extend that idea of community. So where, for example, how do we extend our community of members from 43,000 to 46,000? That's, again, engaging our communities, right? Our membership. Also, how do we think about the global space? And so now, for the first time, we had our first formal forum with international leaders from 7 countries. This was incredible because it allowed us to learn so much more from each other. And it also, again, expanded our local, national, domestic community to now a global community. So I think that that was pretty powerful as well. And then the last thing I'll highlight about the palliative care, which is what you asked me about, but I got pretty excited there. But the other thing that was really exciting about that is, we do webinars on a regular basis here as part of ACCC, and we really try to provide webinars and forums that really respond to what our membership wants and what we know is important to the membership. And so this time we said, okay, I'd like us to kind of expand to an area that we've not done before. As president, let's do a session on palliative care. So I engaged some of our partners from Duke and from Atrium Health, the Clown Walsh, who is an ASCO awardee for his work, both in Europe and in the US, and one of my colleagues at Atrium Health, Wake Forest School of Medicine, as well as Dr. Kimberly Johnson, who is from Duke University, and then also Dr. Ramona Rose, who's in UT Southwest. And all three of them have been really well steeped in this work for a very long time. And so I said, let's bring them on and do a whole webinar session. We were blown away that over 600 people logged in, stayed on, and not only did they stay on, but the chat, conversations, questions were just ongoing throughout the whole session. So much so that we had to create more podcasts in response to the questions that people asked, which is awesome, right? So again, this is another way of expanding our community, if you will, to start bringing in palliative care experts into the teams that we support and serve as ACCC.
There was a couple of other programs that I'd love to talk about with you, two in particular that also have to do with health equity in Appalachia and in rural care. Can you talk about those?
Yeah, absolutely. One of the things that I have always admired about ACCC is that we put health equity centered. We put health disparities centered so that we make sure that the resources that we provide meets everyone, including those who are having the worst outcomes in cancer care, from screening all the way through to treatment and survivorship. What's really powerful about that is that in so doing, it allows us as an organization to really be intentional about ensuring that everyone gets access to the best quality care. And that includes rural populations. Appalachia is amazing. The work we're doing in Appalachia is amazing. We're ensuring that we are engaging our cancer centers in that area. We're particularly engaging the communities there to ensure that people get access to the cancer care that they need. Likewise, in North Carolina, we're also doing some similar work in that space as well, ensuring that we meet the needs of the people in our communities, ensuring that they have access to care. We're starting to think about how do we make sure that telehealth is available so that if people can't make it to an appointment, they can still actually make it to the appointment from their own living room. And so that's a critical part for us because, as we know, rural communities are very much so low resource, oftentimes do not even have an academic health center or a community clinic in there. And if they do, their capacity is not able to meet the growing need of cancer care in that region. So the ACCC, and as we partner with different organizations, we've been really focused on that as well.
You can really feel the energy, and you're part of that. But for the programs and the resources and the people who spend there, like you, who volunteer your time to this organization for the better of patient care, we know you'll still be around, ACCC, and we will see your impact for a long time. We know that you'll continue to move and shake, and we're excited to see that energy. Dr. Barrett, we thank you so much for your service.
Oh, thank you so much. It's been 15 years that I've been a part of this organization, and it's truly been an honor and an incredible experience. Met amazing friends and colleagues that will be friends for a lifetime, and really people who are committed to the work of making a difference for all of our patients across this country and globally to make sure that they get access to the best quality care. And we play a key part in providing those resources and tools to support that. So it's an honor. Thank you so much.
Thank you. Stay tuned to this channel for more This Week from Washington, D.C. at ACCC's 51st AMCCBS. For the Cancer Buzz team, I'm Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.